Healthcare is not a luxury, it's a necessity. It's the foundation of a healthy and productive life. Yet, in America, a nation known for its wealth and innovation, healthcare has become a privilege, not a right. Millions of Americans struggle to afford even basic medical care, forced to make impossible choices between their health and their financial well-being. The cost of healthcare in the United States is staggering. In 2020, the average American spent over $11,000 on healthcare. We spend more on healthcare per capita than any other developed nation, yet our health outcomes lag far behind. Despite spending nearly 18% of GDP on healthcare, the US ranks 37th in the world for health system performance. This discrepancy is a clear indication of a system in crisis, a system that prioritizes profits over people. The consequences of this broken system are devastating. Approximately 66.5% of all bankruptcies are tied to medical issues. Americans are going bankrupt due to medical debt. Over 79 million people in the US have problems with medical bills or debt. They are delaying or foregoing necessary medical care, leading to preventable suffering and premature deaths. An estimated 25% of Americans delay medical treatment due to cost. This is the reality of American healthcare, a system that is failing its people. Mental health is just as important as physical health, yet it remains a neglected aspect of American healthcare. The statistics are alarming. Over 46 million Americans suffer from mental health conditions, but access to affordable and quality care remains elusive, with 56% of adults with mental illness receiving no treatment. The shortage of mental health professionals is a major barrier to care, with a projected deficit of 250,000 professionals by 2025. Long wait times for appointments, averaging 25 days, and limited insurance coverage leave many struggling to access the help they desperately need. Primary care physicians, often the first point of contact for patients, are ill-equipped to handle complex mental health issues. The consequences of untreated mental illness are far-reaching, impacting not just individuals but society as a whole, costing the economy over $193 billion in lost earnings each year. It's time we address the mental health crisis with the urgency it deserves. We need increased funding for mental health services, expanded training programs for mental health professionals, and a societal shift that eliminates the stigma surrounding mental health. In 2019, the US spent only 5.5% of its healthcare budget on mental health services, compared to 10% in other high-income countries. Additionally, 1 in 5 adults experience mental illness each year, yet only 43% receive treatment. Suicide rates have increased by 33% from 1999 to 2019, highlighting the urgent need for comprehensive mental health care. The pharmaceutical industry in America wields immense power, and the consequences are felt by every American who relies on prescription drugs. Drug prices in the United States are the highest in the world, with Americans spending an average of $1,200 per person annually on prescription drugs. The stories are heartbreaking. Patients forced to ration their medications, choose between food and medicine, or even forego treatment altogether because they simply cannot afford the exorbitant costs. In 2019, nearly 1 in 4 Americans reported difficulty affording their medications. The system is rigged against patients, allowing pharmaceutical companies to prioritize profits over people's health. This is simply unacceptable. We need transparency in drug pricing, stricter regulations to prevent price gouging, and increased competition to drive down costs. Studies show that introducing more generic drugs could save the US healthcare system $54 billion annually. Access to life-saving medications should be a right, not a privilege reserved for the wealthy. Section 4. Hospitals in distress, a system on the brink. Hospitals are the cornerstones of our healthcare system, yet they are struggling to stay afloat. Rising operating costs, declining reimbursement rates, and the burden of uncompensated care have created a perfect storm, pushing many hospitals to the brink of financial collapse. In 2020, over 30% of hospitals reported negative operating margins. These financial strains have real-world consequences. Nearly 50% of rural hospitals are at risk of closure. Hospitals are forced to cut staff, reduce services, and delay essential upgrades, ultimately compromising the quality of care patients receive. A study found that 1 in 4 hospitals delayed necessary infrastructure improvements due to financial constraints. In rural communities, hospital closures leave residents without access to vital healthcare services. Since 2010, over 130 rural hospitals have closed. This is a crisis that demands immediate attention. If you find this information valuable, please like and subscribe to our channel for more insights. We need to ensure that hospitals are adequately funded to provide quality care to all Americans, regardless of their ability to pay. The American Hospital Association estimates that hospitals need an additional $200 billion annually to cover uncompensated care and other financial shortfalls. This requires addressing the root causes of the financial strain, including reforming the insurance system and expanding access to affordable care. Section 5. The weight of paperwork, administrative waste in healthcare. The American healthcare system is drowning in paperwork. The administrative burden is overwhelming, consuming vast resources that could be better spent on patient care. From complex billing procedures to endless insurance forms, the system is bogged down by bureaucracy. This administrative waste is not just inefficient, it's costly. In fact, administrative costs account for nearly 25% of total hospital spending in the U.S. The United States spends far more on healthcare administration than any other developed nation, with estimates suggesting that administrative costs amount to over $250 billion annually. A significant portion of those costs is attributed to our fragmented multi-payer insurance system. This is simply unacceptable. We need to streamline administrative processes, reduce the complexity of the billing system, and move towards a single-payer healthcare system that eliminates the need for costly and inefficient private insurance intermediaries. Section 6. A Nation in Need, the urgency for healthcare reform. The evidence is clear, the American healthcare system is broken. Over 30 million Americans are uninsured, and medical bills are the leading cause of bankruptcy. It's time for a fundamental change, a transformation that prioritizes the health and well-being of all Americans over profits and special interests. The need for reform is urgent. Nearly 25% of Americans skip necessary medical care due to costs. Every day that passes without meaningful change, more Americans suffer the consequences of this broken system. Annually, around 45,000 deaths are linked to lack of health insurance. We cannot afford to wait any longer. The U.S. spends nearly twice as much on healthcare per capita compared to other developed nations, yet ranks poorly in health outcomes. The time for action is now. This is not a partisan issue, it's a human issue. It's time for our elected officials to come together, put aside their differences, and work towards a healthcare system that is just, equitable, and accessible to all. Section 7. A Brighter Future. Hope for a Healthier America. Despite the challenges we face, there is hope. The American people are demanding change, and their voices are being heard. Across the nation, people are coming together to share their stories, advocate for reform, and hold their elected officials accountable. The path forward is clear. We need a healthcare system that guarantees affordable, quality care to all Americans. A system that treats healthcare as a right, not a privilege. This is the future we must fight for. A future where every American can access the care they need to live long, healthy, and productive lives. The journey will be long and arduous, but we cannot give up hope. The health and well-being of our nation depend on it. According to recent studies, over 70% of Americans support healthcare reform, and nearly 30 million people could gain access to healthcare with the right policies. Let us work together to create a healthier America for all.